Thanks God. Hi guys, good evening. This is Dr. Jen Ushold, physical therapist and Dr. Physical Therapy. And I'm the founder of Balance and Full Support Group in Aging Adults and also Physiogen PT and Wellness. I'm the current vice chair of the Global Health in Aging in Academy of Physical Therapy, and it's a special interest group. So welcome for our podcast, and we always do this in Thanks God It's Thursday, we call it. So if you are in Philippines, magandang umaga. If you are in Qatar or United Arab Emirates, salam alaikum guys. And good evening if you are in US, all right? So it's another Thanks God It's Thursday. We will go into interview physical therapists. Sometimes we do interview entrepreneurs, academicians, innovators, and even we have one scientist and audiologist before. So for tonight, we have a pain science physical therapist, and she is also more on mental health coach. All right, we are always hearing nowadays mental health and wellness is very important, especially as clinicians. We are physical therapists. We are always drowned with everything happening right now. So it's really tough. So without further ado, let's learn more for our physical therapist, Dr. Jen Ushold. All right, welcome.
Thank you very much for having me. I'm so glad to be here.
You are welcome, Jen. So how do you want me to call you? Just Jen?
Jen is great.
All right. So Jen, I know you're from Virginia and an outpatient physical therapy. You're also the owner of the mental health, the same. You're a mental fitness coach in positive intelligence, and you have a 180 therapy wellness where you work as a physical therapist. Tell us more about your journey. I know you're an outpatient PT, but now also a program director of the Evidence in Motion for lifestyle medicine.
Yes. So it has been a journey. I've been a physical therapist for about 32 years, so very long career. And I quickly fell into an outpatient love, and I did a lot of continuing education, and that's where I got into the certified functional manual therapy work. And so that was very, very impactful in my young career. And somewhere in around 2014 or so, I got very interested in health and wellness coaching. And so I became certified, and I was lucky enough to be in the first national board certification for health and wellness coaches, which is such a great adjunct to physical therapy. It really helps to guide us to what's going to be most beneficial for the clients, because I think sometimes as clinicians, we are too driven by our agenda, and then our clients get left behind when we really want to prioritize what's important to them. And so shortly after that is when I got exposed to pain science. And that was another thing that really changed the path of my career. And I started with a 6-month therapeutic pain specialist program. And then I couldn't quite get enough. So then I did a 1.5 year pain science fellowship. And it was within the fellowship that it just kind of dawned on me that none of this is that different from what we need to do for good health. So when we have somebody with persistent pain, we have so many non-pharmacological options, and many of them have to do with getting good sleep and getting exercise. And those are tenets of everyday health. And so depending on where you are on your health continuum, whether it's pain or disease or illness, we can always be using these same things to move ourselves forward in health and reducing pain, and most important, to improve our function. And out of the Pain Science Fellowship, EIM was then looking to develop a program in lifestyle medicine. And so I was honored that they asked me to kind of corral that program together. And so now, yes, I am the program director. I think we're on our 5th or 6th cohort, and we get really great feedback from our students. And it's so much fun to see what they're doing with the material that they're learning. So, and then, yes, you mentioned the mental fitness coaching. That is my most recent passion. The group is called Positive Intelligence, run by Shirzad Shameen. And this is an amazing approach. Sometimes, mental health doesn't always have the best feel around it. most people are going to latch on to the idea of mental fitness. So we also know it's very clear for most of us clinicians that we need to be approaching from a biopsychosocial model. So we
Mhm.
need to be really addressing the body and the brain. And so mental fitness is a great way to tie all of these other things together.
Wow, that's amazing. I'm just asking one question and that's it. You
One
summarize what
question?
is pain. Yeah, that's you summarize pain science. You talk about therapeutic pain specialist. I remember that. That's also one of your student from EIM. We interviewed Ken, and he is also practicing that. Maybe you're familiar with him, Ken
Yes.
Tanpico. Yes, he studied in EIM, and also
Yes.
when you say
I know his
therapeutic.
name. Yes,
Yes, he's
absolutely.
one of the student there. I interviewed him and we talk about also the therapeutic pain specialty. All right, and that's good. You talk about fellowship, so you have the fellowship
Yes. Mhm.
cohort as well. Yeah. So why do you think mental health is essential? That why we need to talk about it as well, knowing that we have physical health, spiritual health. Now we need to deal more on think about mental health is really important as well, especially nowadays that we have lots of things going on. Can you widen it more, Jen?
Sure. I don't think that we necessarily need to focus on one more than the other. I think we need to look at the client in front of us and really decide with them what is most important for you and what are you presenting symptom wise, function wise, and is our best avenue going to be towards a mix of different approaches, or is it going to be more of a biomedical model depending on how they present? The truth is, we know from studies and research in pain science that anxiety and depression have this two-way directional relationship with people who have experiencing chronic pain. And we also know that sleep is also bidirectional. So what do I mean by that? Is that
Mhm.
poor sleep can impact pain or depression or anxiety, but also pain, depression, and anxiety can impact sleep. So we have to be really looking at the full picture if we're really going to help people get back to a maximum state of health.
Wow. That I'm really regarding that sleep pattern, that's really important. Especially now we are clinicians, majority of us are doing multitasking. You have your job, you still doing some lots of your business, and then also the family. And majority they're staying late doing some other stuff. So sleep is really important. Yeah, I can you give us a sample or a specific case that the client is talking about pain and then when you do holistically you saw that they need to do more on mental health because it's a little bit related with their depression, that's why they have this chronic pain. So what
Yes,
cases usually is that,
I
and what
have
how
a
you deal it, like what you recommend during the process?
sure. And we learn so much by listening to the client during the evaluation.
Mhm.
And I had a new client, I've only seen him, I think, 4 or 5 times. He had two shoulder surgeries 2+ years ago. And he did have a tear on one side, but then pain just showed up on the other side. And it was very confusing to him. And he was doing less and less activity, young in his 30s. And he just got to the point, he's like, he told me, he's like, I'm afraid to do anything. I'm afraid to play basketball. I'm afraid to lift weights. And so as soon as I heard the fear piece, that's when I know the education and the pain science is going to be a very big piece for him. And while, yes, we know that pain is an output of the brain, it's based on inputs from the tissues and our environment. And so we have to consider all of these things. And often, and even he did, he's like, oh, yeah, it's all in my head. And I'm like, well, maybe technically we could say that. However, all pain is real. That's so very important for people to know that we have never scanned fake pain. So when somebody tells you that something hurts, it hurts. Now,
Mhm.
it may not be sourced in the tissues, and that's where we as the clinicians have to do our detective work and help them figure that out. I do a lot of work with imagery. So, in particular, with this client, I helped him understood what pain was. He knows what pain feels like. He knows how it
Mhm.
interferes with his life, but he didn't understand what it was or what it meant. And very quickly, within 2 or 3 sessions, he was doing so much better. He was working out, he was getting back to his regular activity. And this week, he's like, I think I'm ready to cut down to every other week, which I thought was so exciting because he'd been dealing with this for 2 to 3 years. And over 4 or 5 sessions, he's ready to go. He's doing really well.
Wow, that's a nice that's a positive feedback, and also that's amazing for that. How old is the your client? Is it like middle age or 50 plus or
I think
elder
he's 30,
adult?
in his 30s.
Oh,
He's
very
pretty
young.
young. Yeah. So
Mm-hmm.
definitely we want him to have a long, healthy life of movement ahead.
Yes, of course. How about PTSD? Do you have cases like that? Is that included in the mental health, your cases, clients
So
like that?
the mental fitness coaching is my newest offering. So I'm not seeing a lot of people for that exclusively at this point. I
Mm-hmm.
do deal with people with PTSD. That is relatively common with those who have persistent pain if it's related to either micro traumas or a big trauma. And even surgery, honestly, surgery I refer to as organized trauma. And so we can use the mental fitness coaching, but we can also use the pain science approach with this group. And this is a group that it's all about making their nervous system feel safe. And so they
Okay.
may not want to be touched, they may not want to move. And I had a client a couple of years ago. I just wanted to show her a movement with my back, and she couldn't even watch me move my back because her system was so sensitized and elevated. And so that was okay. That was not what she needed right then. And so then we did our work. And a couple weeks later, I was like, do you think you're interested in watching me do this exercise? And she was ready. And so then within, another month or so, then she was ready to try the exercise. So when it's a case of severe trauma or PTSD, we're taking just these little tiny baby steps and really meeting them where their system is so that we can get their system feeling more confident and more comfortable.
Nice. Thank you, Jen. So, what other cases you talk about anxiety, depression, now the PTSD, what other cases that we can refer? As a physical therapist, we do more on physical cases, neuro, geriatric cases, orthopedic, and then when we see a client that will benefit for a mental health coach, so what are the things that we can, like a red flag, that we can refer to you, something like that?
I would say a good fit for the mental health piece, for the mental fitness coaching, is someone who is driven to improve. So the mental fitness coaching through positive intelligence it's a relatively rigorous program for 6 weeks, but what's great about it is it's intermittent throughout the day. So it's a small dose of 2 to 3 minute commitment of doing some of these brain exercises, but it's for a period of 6 weeks. And the idea is to truly create a shift in the brain. So the idea behind positive intelligence is that our brain is either serving us and being our friend, or it's working against us, excuse me, and being our enemy. So within the brain exercises of mental fitness, we're trying to shift that. So our brain is functioning more in the side that's our friend, which is referred to as the sage, versus being stuck in that saboteur mode. Most of us know what that saboteur mode feels like. It's that ticker tape in our brain. It's the rat wheel. We are up all night because we can't stop thinking about a presentation or something we forgot to do. And so that doesn't serve us. Our brain isn't serving us by keeping us up all night ruminating on different things. If it was truly serving us, we would be sleeping, because sleep is such a necessary restorative part of health. And so, again, I think the biggest ticket is somebody has to be willing to commit the 6 weeks to themselves to create this shift.
So we can say it's for everybody, right? So we can say that it's for everybody who wants to improve their mental fitness. Also, even for us physical therapists, that we are burdened, overwhelmed with everything, so we can apply and do the program, something like that.
Yes, yes,
Oh,
anyone can do it. And I love how you made that observation that it's really for anyone. And the way he
yeah.
describes it is his Shirzad Shamin, his research is factor analysis. And there are three main brain exercises that are part of the mental fitness coaching. And he talks about we have three primary colors. Yet within those three primary colors, we have all of the colors in the world. Like there is no limit to the shades of colors that we can create. And so once we understand this basic premise, these three key exercises, there's really no limit to the application. Do you want to apply it to burnout, leadership, cultural diversity issues, parenting, other, and any number of ways you can apply this information. But again, we need the framework first, and then we tailor it to what your needs and desires are.
Wow, thank you so much. This is really eye opener, because sometimes we're only thinking mental health fitness or mental fitness. Oh, you need to have a problem before you need to be there, which is true, but it's not, you doesn't need to be having a disease or an abnormality to be qualified to be there. Sometimes I'm applying something on a form. I didn't know that anxiety and depression was now categorized like as a disability, like so I feel bad because how it will limit more people to say and look for an approach that I am depressed right now, I am anxious. If they categorize it like as a disability, nobody or people will limiting them to go to a mental health therapist to do some treatment. So
Right.
it's a little bit like we even wanted to have the resources out there and make it more. I think I want them to have more knowledge that you can come and ask and do a therapy and we will not judge you. But now I just feel bad that it's a disability.
Right. And it's unfortunate because when we're in that left side of the brain, the saboteur mode, that is where all of our negative emotions are housed. And that includes anxiety and depression. And so, if we have ways where we can exercise our brain to shift out of that and to the right side of the brain, then the anxiety goes away because we're not being hijacked by that negative side of our brain. And so it's less about a label or a diagnosis and more
Mhm.
about what are the challenges in your life and what are the strategies that we have to get you to where you want to be.
Nice. Regarding an exercise, can you give us a sample of exercise, especially for a Balance and Falls member, more on about mental fitness that is easy to do that we can practice?
Okay, so you want a mental fitness exercise that may be
Yes.
able to help with falls?
Yeah, it doesn't matter, just for our listener and people who's watching. Yeah. If you have something related to that, that's good. Maybe the fear of falling, but the high fears of falling, right? That I think that's why you're
Okay.
asking.
Do
So
you do you
anything.
have a client, like you could give me a scenario and then if
Okay.
can we take 2 or 3 minutes for this experience?
So I will go into, I think I want to give you a certain client, this one. So I have an old patient and she is always requesting me because she feels more comfortable with me, but her case is more on a fall. And she is very, this is more on the pain. And I just did kinesiotaping. I talk about the goals, but I really need to always be like a psychologist, not a physical therapist. Every visit, I told her that any physical therapist can help you. You just need to be I know that you have high fears of falls, but I understand that, but you need to fight for it slowly so you can progress. And then it's normal to see and be afraid whenever you be on the same place of where you fall. So that's okay, but we need to fight for it because you will not grow on the next stage if you don't deal with that. So something like that. But she was able to improve after I'm doing more on the touch, more on taping. But there's a mentality that it's if only me who will take care of her, she will improve. And she refused other occupational therapy. But I feel that there's more, you know? So, and also she's complaining of pain here,
What
pain there.
what's a particular fear of falling that she has?
Oh, because she had a fall that one time she she tried to shoo the fly in her. So now she fell on her back and she really had a fracture at one point on the spine. So that's the incidence. So from that point, she's very hesitant to walk too much, walk fast because she will fall, do those stuff, she will fall, and then that make a big mark on her brain because it's a trauma. So she just doesn't want to do it again. So I feel that she's psychologically fit for a mental fitness coaching just to make it positive, from the negative things happen to her. So what can we deal with our coaching for
All right.
her? Something like that.
Would would you like to participate in this experience that would be
Okay.
appropriate for her? Okay.
Yeah.
So,
She's not with me now, but I just remember her.
okay.
Yeah.
If you're comfortable, close your eyes and I'll close my eyes also. And I'm going to ask that you first just feel yourself in the seat that you're sitting and feel your feet on the floor and your back against whatever surface you're on. And let's start by having you bring your hand to your stomach or your chest and just gently feel the rise and fall as you're breathing. If you have a thought or an emotion enter your mind, just come back to the physical sensation of breathing in and breathing out. And now we're going to shift to sounds. In the environment and where you are, what is the furthest away sound or maybe an ambient sound that you can hear? And now, what is the closest sound that you can hear? And can you hear your own breathing? And now I'd like you to remember a time where you experienced a fall and some of the circumstances surrounding that. And now I'd like you to try and imagine something different that you could do if you were in that same situation where you wouldn't end up falling and you've stayed steady and grounded and on your feet. By reimagining past experiences, we can start to pave new neural pathways in our brain. Imagine a dirt path becoming a very well-worn and paved path. That's what we're trying to do with the reframing and the imagery. And when you're ready, you can open your eyes.
Nice. That's really nice. It's like in a peaceful environment. Yeah.
Yeah.
So I want to answer those, but I really hear whatever you ask. What do you hear? Hear the vehicles outside my house. And then what's the closest one? It's the computer, like the air of the computer, things like that. So but the one that I cannot sit in because it didn't happen to me. You know, you remember the fall. You know, I'm about to joke like, no, no, I don't want to go there. Maybe they will stop. No, no, I want to stop because they're already there. So like in the movie, I imagine now, like it's in the movie that you want them to be in the on the spot, and then they're seeing their fears. Is that the imagery? The neuroimagery?
So
That's why you ask.
that's part of the imagery work. And
Wow.
what's so beautiful is that there's so much crossover between pain science and the mental fitness coaching. It's just a absolutely beautiful blend. So I use imagery in pain science, and I also use the imagery with the mental fitness, and I'm sure they're just going to blend into one within a couple of years.
Wonderful. This is amazing, Jen. I had never experienced that. I only just watch it, you know, in the series I always watch because, you know, whenever they have those issues, they will go to their therapist, and that's what they keep doing in their clinic. Yeah. And
Right.
then this is really good. So if we want to be in this, to add this kind of skills, what other certification? Do we need certification? I think you did something, you said, or any books or courses that we can read or try to work on?
So specifically for the mental fitness coaching, if you are a coach of some sort, whether it's a health and wellness coach or a life coach, you can take this course through Positive Intelligence, and their website is positiveintelligence.com. It is not yet being offered to those who are not coaches. So there would be a little bit of a stepping stone there. However, pain science, there's so much good work that we can do within pain science, which has a very similar feel to it. And most of my training is with evidence and motion. And so they have several different courses on pain science. You can do a little bit, or you could do a deep dive and do the fellowship. But those are the two main areas. And the positive intelligence, it's a book. So people that are really
Mm.
motivated, they can read and learn a lot from the book in and of itself. And the website offers a fair amount of great information as well. And they even offer the ability to take what's called the saboteur assessment. So you can take this little quiz online and get an idea of how strong are these different characters in your brain. You know, we have the pleaser, so the person who's always trying to please someone else even at the expense of themselves. Or we have the hyper rational, the person who thinks through everything to where it becomes detrimental in their life instead of helpful. So there's 10 of these different characters. And even sometimes just the awareness of, oh, you know what? I didn't realize how much I was pleasing all the time and things like that.
Wow.
So it's a nice place to start and get some good exposure.
Yes, getting to know yourself, right? Like you keep saying yes for everything. You're so weak to say no. Something like that, right? Oh, oh, I want you to come with me because I want somebody to, even you're busy and because you want to help and everything at the expense, you just say yes. Oh my God. Yeah, that's another problem. Yes.
Yeah.
Thank you so much. This is amazing experience. We learn a lot from you, Jen. So how can we connect with you? So, like, if we have some questions, our listeners and other clinicians, therapists would love to learn more. So, we would love to connect with you.
Yes, I would love to hear from your listeners and your clinicians. The best email for me at this point is jen at iriseforme.com. It's just the word I, rise, R-I-S-E, F-O-R-M-E. And I'm happy if people want to, they want to text me. My phone number is 703
Wow.
859 3415. And physical therapy, my physical therapy work is at 180therapyandwellness.com.
Thank you, Jen. We appreciate you. And also, you gave us a book that positive intelligence is one way to check all the different resources. So, that's really good. Even the name
Yeah,
itself, be
yeah.
positive. You always
And
say,
if
be
anybody
positive.
if anybody's interested in going through the 6-week program, I would be thrilled to take them through it. It's intense, it's fun, and just life changing. It's been really life changing for me. Like my ability to function and think on the spot and have so much less anxiety when I'm going into important meetings and conversations. It's been tremendous. And a big piece of it is the positive intelligence work.
Wow. How does the 6-week programs does is it like every day, or you meet at once a week? Is it via online?
Yeah,
Something like that.
great question. So they have a tremendous app. And so once a week on Saturdays, about an hour's worth of content and videos gets dropped in the app. And then Tuesday through Friday, 4 times a day, they'll prompt you in the app to just do a 2 to 3 minute exercise. And then there's a weekly meeting with the mental fitness coach, whether that's me or someone else. And so that's usually on a Monday or a Tuesday, so that you can review the content and then apply it over Tuesday through Friday when you have the coach challenges in the app. So the app is great, and you have access to your pod community. You also have access to the big positive intelligence community. So there's so much learning that can happen within the app, even in addition to the content. And it's a
Wow,
6-week
that's
program.
good. 6-week programs that so the coaches, so you're the coach and you will have a specific students assigned to you. And then the other coaches will be different. Is it like that? They
So
will
they would
assign
sign up. Anybody that wanted to go through the program with me would sign up with me. And if they wanted to go through the program with a different mental fitness coach, they would sign up with
so
them.
there are many other different coach. Okay. But
Yes.
there's no limit how many students can be assigned to you. There's no limit
Correct.
for that one. Okay, okay.
Correct. Yeah.
That's nice. And it can be, all right. So when you begin the 6-week programs, it will be closed. And then the next 6 weeks again. That's how it works, like a cohort
What
or no?
What's fascinating is that people can start every Saturday.
Okay.
So right now I have a group of 3 that's on week 4, and then I have a group of 3 that's on week 2. So they're kind of
Mm.
going through just a little bit staggered. So there's lots of different ways it can be done.
Okay. So they don't need to wait for the next batch to come in. They can join and then you can be on that level. So you can still guide them. Is it correct?
Well, once I
Miss
have a
Joyce?
group, if I
Uh-huh.
have a group, like I would want a minimum of 3. So probably 3 to 6 is the ideal number, so that they get a good experience out of the group. And
Oh,
then
okay.
we would pick a start date.
Ah, okay. So you still needed that at least as much as possible. There should be a good date that everybody can be in a certain time frame. Okay, good to know. Thank you so much, Jen. We
Thank
appreciate and
you.
we learn a lot. This is really amazing. We heard pain science before, but more on mental coaching is really very important for us, especially nowadays, even younger the teenagers, the younger students, they really need to be more involved in this. I'm sure there's no limit of age who can be applicable for these things of coaching, right? Mhm.
Right. So the research goes to 18 as the youngest. However,
Oh.
people are using it with younger kids as well.
Mhm.
And they can get it. Yeah. I'm trying to find a way. I think I have my 20-year-old almost convinced to go through it with me, and I would like to get my 16-year-old too. So
Wow. Until now, I keep thinking, amazing, you have 21 years old kids and you look so young. All
thank
right.
you.
And then also, yeah, because the kids nowadays, the bullying, the peer pressure, so they really needed more confidence to fight back in this emotionally,
Yeah,
and so
really do.
that's really good. So it's a fresh air for us to learn more about this. So thank you so much. We would love to hear from you more in the future. Thank you for your time and sharing
Thank
your
you.
knowledge, Jen.
Thank you so much for inviting me. This was great fun.
Yes. So guys, that's Jen Ushold. We learn a lot from her, mental fitness, what is mental health, and also some exercise techniques to improve like the imagery and also like what are the different, who are the people that can benefit, you know. So it's for everybody who wants to improve more so we can learn more in positive intelligence. So if you want to learn more and connect with Jen, so I will going to put it on once I post it, and connect with us in FishGen PT and Wellness. Any questions? And we can also put the email of Jen there. All right. Thank you so much, guys. And it's
Thank
another
you.
thanks God. It's Thursday. Thanks, Jen. And hello in Virginia. And mabuhay, guys, in Philippines. God bless. Thanks again for watching. Bye for now. It's me again, Dr. Jenny, physical therapist and board certified geriatric clinical specialist. If you have any concerns, we are here for you. All right. Bye for now, guys.